Good morning, good day. Today I would like to present our abstract video from our study entitled The Immediate Effect of Porang-Processed Rice or Amorphophallus Muelleri on Triglyceride Levels in patients with type 2 diabetes and dyslipidemia. The study was authored by Satrio Adiwijaksono, Zahrin Asifa Nurpalisma, Taufik Eko Nugroho and Sulistiati Bayu Utami from Faculty of Medicine, Diponegoro University, Semarang, Indonesia. Our abstract is, from the background, the Diabetes Mellitus or DM is a major cause of death and disability in the world. The Diabetes Mellitus is related to metabolic disorders in glucose and lipid levels in body. Porang tubers contain glucomannan, a substance that has many health benefits such as ameliorating blood glucose and lipid profiles, and has been processed as many food products such as porang-processed rice. This study investigated the immediate effect of porang-processed rice or PR on triglyceride levels compared to white rice, here is WR, in patients with diabetes and dyslipidemia. The methods. It was a randomized clinical study with an experimental pre- and post-test control group design held from October to November 2021 in Diponegoro National Hospital, Semarang, Indonesia. A total of 24 study subjects were selected by quantitative sampling. The inclusion criteria were patients diagnosed with DM or diabetes or has been consuming routine oral antidiabetic drugs and has signed a written informed consent. The subjects were divided into two groups, which is the treatment groups and control groups. Each consists of 12 subjects. The treatment group was given a porang rice diet of 300 grams 3 times a day for 5 days, and for the control group will consume white rice diet for 5 days. Triglyceride levels were measured and compared between both groups before and after the treatment. Triglyceride levels were measured using venous blood sampling. All subjects were still consuming routine medication during the study. And here are the results. There were no differences in baseline demographic and clinical characteristics of participants. At pre-treatment, there was no significant difference on triglyceride level between group with porang-processed rice and that with white rice. At post-treatment, there was also no significant difference on triglyceride levels between group with porang-processed rice and that with white rice. However, there was a larger decrease of triglyceride levels, here we call that delta triglycerides, in group with porang-processed rice compared to that white rice. As a conclusion, there were no significant differences in the triglyceride levels before and after porang-processed rice or white rice in patients with diabetes and dyslipidemia. However, there was a larger decrease of triglyceride levels, delta triglycerides, in group with porang-processed rice compared to that white rice. If confirmed by further studies, of course, with this study need more larger studies and further studies. If confirmed by further studies, porang-processed rice might have role as nutraceutical plant in stabilizing lipid profiles, especially triglyceride levels in patients with diabetes and dyslipidemia. That's our study. Thank you for your attention.